Hello everyone, and welcome to the live class for what to do when an injury occurs. I am Dr. Jeanette DeWitt, and I'm a physical therapist, an athletic trainer, and a fitness coach. And today we're going to talk a little bit about what you should do in the first 24 hours of an injury. Actually, what you should do in the first 5 minutes of an injury, what you should do in the first 24 hours to 72 hours, and what you should do in the first 15 days following an injury. And then we will also talk about how long it takes to recover and get back into your sport or get back to doing the things that you love to do. So let's go ahead and just dive right in. And what should you do in the first 5 minutes of an injury occurring? Well, the number one thing that you can do to reduce your risk of having the injury be prolonged is actually a very simple thing: apply ice. That is the most important thing that you can do, because what happens is when an initial injury occurs, for example, let's just take an ankle sprain. When somebody sprains their ankle, they may have stretched or torn a ligament or even a couple, 2-3 ligaments. And the problem is when you don't apply ice right away, the swelling that occurs can actually create what we call secondary hypoxic injury. And that means the surrounding tissue can also be injured as a result of the injured area. So the primary area of injury would be the ankle sprain of the ligaments, but then the surrounding muscles and tendons can also be affected, and that's what we call secondary hypoxic injury. So when you apply ice, you will reduce the pressure and the swelling that's going to be placed on those secondary structures. Very, very important to apply ice within the first 5 minutes. And I also want to dispel a myth that we don't want any inflammation. It's actually important, and a very natural part of the recovery period is to have an inflammatory response. That's when your body's naturally trying to heal itself, and it's naturally sending nutrients to the injured area to start to repair itself. So it is important to have an inflammatory response, but we want that to be a healthy response. We don't want it to get out of control, and we don't want your pain to get out of control. So applying ice is the number one thing that you can do in the first 5 minutes following an injury. Now, what can we do in the next 24 to 72 hours following an injury? And the number one thing you can do here is an acronym called PRICE. P is going to be for protection. You want to protect the area that was injured. And if it's a mild injury, you may not need to protect it as much. But if it's a significant injury, you may need to brace it or immobilize it. So you might need to put a brace on a knee, you might need to put a brace on an ankle, or you might need to put your shoulder in a sling or kind of baby it a little bit. That's protecting that area. The second letter in our acronym PRICE would be to rest it. That means to get off of it. Don't use it as much initially. Again, to baby it a little bit. So if it is a leg injury like an ankle or a knee or even a hip and it hurts to put weight on it, then you actually want to either go non-weight bearing or you might be weight bearing as tolerated and using some crutches. If it's an arm injury, again, you would want to keep it protected and rest it by putting it into a sling. The third part of PRICE is I for ice. So you want to continue that ice to control pain and to control swelling and inflammation. The fourth part is C in PRICE, and that is compression. So you want to go ahead and wrap that ankle or wrap that knee with an ACE bandage, or if you have a walking boot or a brace, that's going to compress that and help with circulation, help with swelling, help with inflammation, and also give a little bit more protection to that area than you would if it was not wrapped. The final part of PRICE is elevation. So E is for elevation. You want to get your leg up. Don't have it dangling down and resting below your heart, because the swelling can actually pull into the area and create more of a throbbing sensation. Now, if it's your upper body and it's your hand, you can actually just put it up above your heart like this, or you can rest onto a table like this. If it's your shoulder and it's in a sling, it's kind of level with the heart. But you don't want to have your arm like dangling or shoved into your pocket. You can kind of get a lot of swelling in the hand, and when that happens, your fingers may look like little sausages, and we actually call that sausage fingers because the swelling is just pulling down into the hand. So that PRICE acronym: protection, rest, ice, compression, and elevation. Those 5 things are super important in the first 24 to 72 hours. Now, the next thing you can do in the next 24 to 72 hours would be to seek medical attention. And when should you seek medical attention, and who should you seek? That's usually the 2 questions I get. If you're having sharp pain, you can't put weight down on your foot, or you can't weight bear even through your hand to lean on something because of your arm pain. If you have deep pain, if you have nocturnal pain or night pain that's not allowing you to get proper sleep, these would be reasons to go seek a physician. Now, if you have sharp pain immediately, I would go to the emergency room or an urgent care so that you can get an x-ray, because if you have sharp pain, you can't put your weight down on it, and it's 10 out of 10 on a pain scale. That requires emergency care or urgent care assistance. If you kind of wait and it's really dull, achy, it's throbbing, it's a deep pain, it's keeping you up at night, it doesn't seem to be getting worse, it doesn't seem to be getting better, that's when you want to go seek your family physician, an orthopedist, a pediatrician. You can even contact a physical therapist like myself and ask for advice on whether they should see you, the physical therapist, first, or whether they should seek a physician. And then that brings me to the physical therapist. When can someone bypass their physician and seek out a physical therapist first? This would be for someone who is noticing that they can put weight on their leg or through their arm, and they can get relief using that PRICE acronym, and they also are able to sleep. So those 3 things, you could probably go and consult with a physical therapist first. If your pain is not worsening, in fact it's decreasing with the use of PRICE, if you're able to sleep through the night, and if you're able to put weight on it, or you're able to go through some range of motion with minimal symptoms, you could start with a physical therapist at that point. Another thing that you can do is I use essential oils in my office, and if you're having inflammation and swelling, there's actually an essential oil layering technique I use doTERRA products, so I can't not speak for other essential oil products, but I can speak for doTERRA. And I use a layering technique with Deep Blue, which that provides a cooling sensation. It also has some anti-inflammatory properties in it and can help with relieving joint pain and muscle pain. Then I put that on, and then I apply lemongrass, which helps to refresh muscles after a workout. It also has analgesic and anti-inflammatory properties. Then I apply cypress, and that promotes energy and helps to relieve muscle pain. And then I apply peppermint, which also gives a cooling sensation, and it has an analgesic or anti-inflammatory properties as well. So those 4 essential oils are layered step by step by step by step to help relieve muscle pain, joint pain, help with anti-inflammatory and analgesic properties. Now, after the 24 to 72 hours, what should you do in the next few days up to 15 days? I would definitely continue PRICE, that protection, rest, ice, compression, and elevation. I would continue using the essential oils layering technique. And if the pain is not gone or significantly better within 8 to 10 days, it's probably not going to get better on its own. So if you haven't sought medical attention at that point, you want to go ahead and contact a physical therapist or contact an orthopedist or a physician. Usually pain that's not decreasing or going away within 8 to 10 days will not get better on its own, and it needs more therapeutic interventions than what you can provide by yourself at home. And just a little side note with physical therapy, the research shows that for people who seek out a physical therapist within the first 15 days of an injury are less likely to utilize pain medication, or if they need pain medication, they're less likely to use as much of it. They're also more likely to have a faster recovery because they're getting the guidance of a physical therapist and the knowledge of a physical therapist to take them through what they should and shouldn't be doing. That way they're really promoting good tissue healing and injury recovery. Now, many people also ask me, how long does tissue take to heal? And some of that really depends on the severity of the injury, but a general guideline is about 4 to 8 weeks. Now, that doesn't mean that you're not back to your sport. It doesn't mean that you're not back to doing many of the things that you love to do. It just means that you're doing them with caution. For example, if we look at that ankle sprain again, and let me just do a little side note here versus a sprain versus a strain. A sprain is a stretch to a ligament, and a ligament connects bone to bone. A strain is a stretch or a pull of a muscle, and a muscle and a tendon connects muscle to bone. So when you have a muscle injury, that's the muscle the muscle belly, and that's where the big fleshy part of the muscle, that's the part that's doing work. And then you have the tendon, which is connecting the muscle to the bone. On a sprain or a strain, there are 3 levels of injury. A grade 1 sprain or strain is a mild stretching, sometimes some micro tearing of that tissue, whether it's a ligament or a muscle. A grade 2 is where you might have some problem putting weight down on it. You also might have some discoloration, and you have some partial tearing or some definite stretching of the tissue. And then a grade 3 is a rupture that's usually requiring a surgical repair, whether it's a ligament or a muscle. So that's usually what's happening at a grade 3, and that's excruciating pain. So sometimes a lump, if it's a muscle, it's like the muscle is balled up on itself, and you can visibly see a change in the muscle tone and the muscle deformation. So when we look at that, if there's a surgery that takes place that's going to take a lot longer to repair, that can take up to 6 to 12 months after a surgery. Again, it doesn't mean you're not back walking, you're not doing regular daily activities, but anything more strenuous might take 6 months to a year to get back to where you feel like your injured side is pretty comparable to your non-injured side. The grade 1 and the grade 2, that really is dependent on the person. So if it's a grade 1 and it's very mild, somebody could get back into their normal activity within just a couple days. They might have some tenderness, they might have a little bit of residual swelling, but it might only take a couple days to get back to doing what they want to be able to do. And it doesn't mean the tissue is fully repaired, it just means that it's not inhibiting them from doing things that they want to do. Versus a grade 2 it would definitely follow that 4 to 8 weeks, maybe even 12 weeks guideline, because you had discoloration, you had swelling, you had more significant stretching or tearing of the muscle tissue, but you didn't have a complete rupture of that tissue. So when we look at how long an injury takes, we really have to respect that tissue healing process. If you tweak something because you worked out, maybe you lifted heavier weight, that's a mild stretch on your tissue. So that's probably only a few days, 2 to 4 days, and you're back to no soreness and no swelling. But a more significant injury where you've actually had some tearing take place, that's going to take a good 4 to 8 weeks to heal, and you're going to need to adjust your normal routine to accommodate that tissue healing. I hope that if there's any questions that you posted them into the feed. I'm actually not able to see those right now, so I apologize for that. I'm not sure why Facebook's not showing me your comments, but please feel free to put your comments and your questions into the comment section below, and I will make sure that I answer those questions so that you get answers. And if you have questions and you want to chat with me individually, please feel free to call 262-842-2220 or email me directly at Jeanette@dewittptwellness.com. I look forward to helping you. If you know of anyone who has had an injury, or if you've been suffering with an injury yourself, I'm here to help you, and we can just start with a conversation and see what your next steps are. Thank you so much, and I hope you have a blessed day. Take care.